Colon cancer is a type of cancer that starts in the large intestine, which is the final part of the digestive tract. Colon cancer is one of the most common types of cancer in the world. According to the World Health Organization, it was the third most diagnosed cancer and the second most deadly cancer in 2020. A very big problem here is that it is also one of the most difficult cancers to detect early. It usually begins as small, non-cancerous growths called polyps that form on the inside of the colon. Over time, some of these polyps can turn into cancerous tumors. Colon cancer can affect anyone, but it is more common in older adults and people with certain risk factors, such as family history, inflammatory bowel disease, smoking, obesity, and poor diet. One of the main reasons why colon cancer is hard to diagnose is that it often does not cause any symptoms until it is advanced. Another reason is that it develops slowly over many years. It starts as polyps, which then turn into cancer. However, this process can take a long time, sometimes up to 10 years or more. This means that colon cancer can be present for a long time before it is detected. That's why it is important to get regular screening tests, such as colonoscopy, which is a procedure that uses a thin tube with a camera to examine your colon and look for polyps before they become cancerous. But still, there are some early symptoms that should not be ignored. So in this video, we will share with you these early signs and some lifestyle changes you can do to prevent this disease or lower your risk of getting it. So, let's get started. Number 1. Blood in your stool or rectum. One of the most common and noticeable signs of colon cancer is blood in your stool or rectum. The blood can be red or dark in color, depending on where the bleeding is coming from. Blood in your stool can be caused by many other conditions, such as hemorrhoids, ulcers, infections, or inflammatory bowel disease, so it's important to see your doctor if you notice this symptom. But in some cases, blood in your stool can indicate that there is a tumor or a small growth in your colon that is bleeding. Sometimes these polyps or small growths can be benign, which simply means not cancerous, but they can also turn into cancer over time. That's why it's recommended to have regular screening tests to check for and remove any polyps before they become cancerous. Number 2. Change in your bowel habits. A sudden change in your bowel habits, such as diarrhea, constipation, or narrowing of the stool, can be an early sign of colon cancer. This can happen because the tumor or the polyp can block or narrow the passage of your colon, making it harder for the stool to pass through. You may also feel like you need to have a bowel movement but you can't, or you may feel like your bowel is not empty after going to the bathroom. These changes can also be caused by other factors, such as diet, stress, medication, or infection. So don't panic if you experience them occasionally. However, if they last for more than a few days or weeks, you should talk with your doctor. Number 3. Abdominal pain and cramps. A common sign of colon cancer is abdominal pain or cramps that don't go away. This can be due to the pressure or irritation caused by the tumor or the polyp on your colon wall or nearby organs. You may also feel bloated or gassy because of the obstruction or inflammation in your colon. Sometimes the pain can radiate to other parts of the body, such as the back or pelvis. The pain can also be accompanied by other symptoms, such as nausea, vomiting, bloating, gas, or constipation. Number 4. Weakness or fatigue. Weakness or fatigue that is not explained by other causes can be a sign of colon cancer. This can be due to the loss of blood from the bleeding in your colon, which can lead to anemia or low red blood cell count. Anemia can make you feel tired, dizzy, pale, and short of breath. You may also lose weight without trying because of the reduced appetite or the reduced absorption of nutrients from your colon. Number 5. Nausea and vomiting. Nausea and vomiting are not very common symptoms of colon cancer, but they can occur in some cases, especially if the cancer is blocking the bowel. So, these are some of the early signs of colon cancer that you should be aware of and pay attention to. If you have any of these symptoms, don't ignore them or hope they will go away on their own. See your doctor as soon as possible and get tested for colon cancer. The earlier you catch it, the better your chances of survival and recovery. But if you don't have any of these signs, these are great news. But now, what can you do to prevent or lower your risk of colon cancer? Well, here are some tips. Number 1. Eat a healthy diet that is high in fiber and low in red meat and processed foods. Fiber can help prevent constipation and keep your colon healthy by moving waste out of your body. Red meat and processed foods can increase inflammation and damage your colon cells. This is because red and processed meat contain substances that can damage the DNA of your colon cells and cause them to grow abnormally. Some of these substances are the heme iron and the nitrates and nitrites added to processed meats. Heme iron is the type of iron found in animal blood and muscle. It can react with other chemicals in your gut and produce harmful compounds that can damage your colon cells. Nitrates and nitrites, on the other hand, are not naturally occurring, but they are added to processed meat as preservatives. These chemicals can also form harmful compounds in your gut that can interfere with your DNA and cause mutations. Number 2. Exercise regularly and maintain a healthy weight. Physical activity can lower your risk of colon cancer by up to 24%, according to the National Cancer Institute. The exact mechanism is not yet clear, but it is thought that it is because exercise increases the natural killer cells in your body, which are your body's first line of defense, as their job is to kill tumors and infections. So aim for at least 150 minutes of moderate intensity exercise per week. Number 3. Quit smoking and limit alcohol consumption. Smoking and drinking can damage your DNA and increase your risk of developing various cancers, including colon cancer. Number 4. Talk with your doctor about your personal and family history of colon cancer and other diseases. Your doctor can help you determine your risk level and recommend the best screening schedule for you. The American Cancer Society recommends that people start getting screened for colon cancer at age 45, or earlier if they have a family history or other risk factors. Number 5. Don't ignore any symptoms that could indicate a problem with your colon. If you notice some of the symptoms we talked about today, see your doctor as soon as possible. Remember, early detection is key. At the end, colon cancer is still hard to diagnose, but it is not impossible to prevent or treat. By following these tips, you can reduce your risk of developing this disease and increase your chances of surviving it if you do get it. Thanks for watching.